Good morning to one and all. I'm Dr. Priyanka, and today's lecture topic is Principles of Tooth Preparation Part 1. This lecture has been divided into Part 2. Okay, coming to the learning outcomes. So, firstly, you need to understand how to evaluate the abutment teeth, discuss the principles of tooth preparation, categorize the finish lines, discuss everything, the details of the finish line, advantage, disadvantage, indication, contraindication, identify factors influencing retention resistance of a cemented restoration. Okay, all right. So, coming to fundamentals of tooth preparation. So, according to Rosenstiel, it is divided into three aspects. Okay, so there is a Venn diagram in Rosenstiel you all can refer to. It's biologic, mechanical, and aesthetic. So, biologic is health of oral tissues. Mechanical is integrity and durability of restoration. Aesthetic consideration is the appearance. Okay. Coming to the fundamentals of tooth preparation, according to Schillenberg. So, guys, I keep on talking about Schillenberg, Rosenstiel, right? The standard textbooks of FPD. So, these are the names of the authors, guys. So, according to Schillenberg, tooth preparation, fundamentals of tooth preparation is preservation of tooth structure, retention and resistance, structural durability, marginal integrity, preservation of periodontium. So, basically, according to him, it can be divided into these groups. Okay. Okay. Right. Okay. So today we are dividing principles of tooth preparations into five. That is preservation of tooth structure, retentions and resistance, structural durability, marginal integrity, and preservation of function. Okay. Coming to the preservation of tooth structure. All right. Yeah. So we need to preserve whatever we have, guys. Okay, we cannot just go through and extract whatever is seen or required. Okay, so only when indicated we should advise the patient to go through the extraction, and only in a very poor or hopeless prognosis case, if we are not able to preserve the teeth, then only you should go through the extraction procedure. Okay, all right. So in any other case, we are supposed to preserve the tooth structure. Okay, so you have to prep the teeth according to the standards. You cannot over prep, over contour any tooth structure, because that is going to affect in turn the prosthesis, the final prosthesis. Okay, all right. So coming to the partial veneer versus a full veneer crown. Okay, so you can also do a partial veneer or a full veneer crown. So that can be decided according to the tooth structure. Okay, all right. Okay, coming to a supragingival and a subgingival margin. So there are indications when you can give a supra or a subgingival. Usually we are trying to gingival margin. All right. Okay. So under the preservation of tooth structure, there are certain important points, which is avoid over reduction of all surfaces of the tooth, avoid excessive occlusal reduction, achieve correct occlusal surface, okay, avoid flat occlusal surface, reduction based on requirement of restoration, okay, and excessive reduction. So guys, in short, you're supposed to take care of the tooth structure and avoid over contouring or structuring the teeth, taking out things which are not required. Sorry, preparing the structures which are not required, meaning preparing excessively. Okay, so giving an all ceramic margin in PFM crown will not help, and so vice versa, guys. Understand, right? So you're supposed to avoid any of the excessive reductions. So excessive reduction is will definitely create some hypersensitivity, pulpal inflammation, necrosis, if it's a vital teeth, loss of retention and resistance. Okay, so these things have to be. Okay, all right. Okay, coming to the retention and the resistance form. Okay, so geometric configuration of the tooth preparation looks like that, guys, and the retention prevents removal along the path of insertion on the long axis. Okay, so path of insertion on long axis, that is the retention. Okay, um, the oblique forces which prevents dislodgement are the resistance form. Okay, so resistance basically prevents dislodgement of oblique forces. So any of the oblique forces, the resistance form will try and prevent it. Okay, so retention and resistance are interrelated and inseparable qualities which both have to be taken care of, guys. Okay, if you take care of both, there will be no dislodgement of the crown, and the crown will seat properly as well. Okay. Okay. So for retention, the essential element of retention is two opposing vertical surfaces of the same preparation. Okay. So two opposing surfaces of the same preparation. Um, these may be external surface such as buccal or lingual walls. Okay, like in case of a full veneer crown. The opposing surface can also be internal, such as a buccal or a lingual wall of a proximal box of an inlay. Okay, so here you can see an inlay, here you can see a crown. So even the inside portion gives us some retention. Okay, so anything marked inside is also trying and giving us retention. So that's why we need to do a proper preparation if you're doing inlay, onlay, crown preparation, so that those features will enhance the retention. Okay, so here how you can enhance the retention um, is by giving some grooves, latches, box. Those things can be made, guys. Okay, so in retention and resistance, you can see and you know any of these factors are going to help us and provide a proper retention and resistance, guys. Okay, okay, so um, yeah, sorry. So the amount of taper given in anterior posterior are important. So it ranges from 2 to 3 degree, 3 to 6 degrees, guys. Okay. So what's the amount of taper which has to be given, and how's the tooth supposed to look? That has to be important. Okay. Okay, so freedom of displacement means if you do a proper prep and if the taper and everything is in place, it will limit the path of insertion and limiting any torquing forces in the horizontal plane, guys. Okay, so grooves can be given, guys, just to improve the freedom of displacement. Okay, so that it doesn't happen, guys. Length should be adequate, guys, and we cannot stress more. You have a over contoured or reduced crown, it will keep dislodging and there will be no point of doing it, guys. Okay, so length should be adequate. Substitution of internal features, if required you can put in some grooves or boxes if required, if it's going to help you in retention, do it. Okay, and incorporate it. Path of insertion, if you have given all the proper mentioned uh, characteristics, then it should be one. Okay, then there will be no multiple path of insertion and the crown will usually not dislodge. Okay. Okay, guys. So, the amount of taper given, or the at least the taper. So, what the taper is more nearly parallel the opposing wall of a preparation, the greater is the retention. So, uh, any of the taper you give any degree is gonna make the crown seat properly onto the tooth structure. Okay, and it's going to enhance retention. Okay, so tooth preparation taper should be kept minimum because of its adverse effects on retention. So of course you cannot give a lot of taper, but as advised and as much as required you should be able to give that. Okay, all right. Okay, so here this is showing the taper, guys. Okay, so that is 6 degrees, this is 3 degrees, guys. Okay, so the axial walls of the preparation must taper slightly to permit the restoration to seat. Okay, so definitely the axial walls need to taper a little bit. Okay, so for easy seating of the prosthesis and for better retention. Two opposing surfaces each with a 3 degree inclination, that is like a diamond held parallel to the intended part of insertion, that is 6 degree taper. So you should be able to know and appreciate the amount of taper, and you should be able to incorporate it in your your preparations. Okay, walls are tapered so you can visualize the preparation walls, prevent undercuts. So this is the advantage of taper. Sorry. So to compensate like any fabrication inaccuracies, okay, that it will also compensate for that. So it would come it would permit complete seating during the cementation. So guys, it has multiple advantages. Okay. Okay, coming to retention and resistance. Occlusal-gingival length. Okay, occlusal-gingival length is an important factor of retention and resistance. So the greater the surface of preparation, the longer the teeth, the greater the retention. Okay, so preparation of large teeth are more retentive than preparation of small teeth. Okay, cement creates mechanical interlocks between inner surface of restoration and axial wall of preparation. Okay, so at the end, if you incorporate all the features, the cement is going to enhance the retention. So it's going to interlock and do a mechanical retention. Okay, and it's going to be between the tooth surface and the restoration. Okay, so surface area can be increased by adding boxes and grooves if required. The shorter the wall, the more important its inclination. Shorter preparation, as little taper as possible, is used to increase the retention resistance. Okay, so we have to incorporate all these features, guys. Okay, coming to the continuation of the same, limits the path of withdrawal. Okay, so it actually gives retention if you have a proper taper and if any retentive component is required. Long and parallel axial walls and grooves give us good retention. Short or tapered preparation. Usually the restoration is easy to remove and it's less retentive, okay? And limiting freedom of displacement from torquing or twisting forces in a horizontal plane, okay? So, and any additional internal features such as boxes and grooves. So these are the things which has to be incorporated, okay? Sorry guys, just give me a minute, please. Okay, so we have seen occlusal reduction. Okay, inadequate occlusal reduction also seen. Okay, Okay, so functional cause bevel, if there's a lack, what happens? So lack of functional cause bevel may produce several problems, that is thin area or perforation, may result in over contouring and poor occlusion. Okay, over inclination of the buccal surface definitely will destroy excessive tooth structure, reducing retention. Okay, so these are the problems which can arise if we do not give proper function. Okay, so coming to the axial reduction, so this also plays an important part in securing space for an adequate thickness of the restorative material. Okay, so yes, the axial preparation has to be really good. Okay, so inadequate axial reduction will have thin walls, which is subject to distortion or result in over contouring the axial surface, which would lead to periodontal problems. Okay, so any inadequate reduction anywhere would definitely affect the periodontium and will have periodontal problems. Okay, to be taken care of seriously. Okay, structural durability. Okay, there are other features too that serve to provide space from metal that will improve the rigidity and durability of the restoration. That is the offset, occlusal, shoulder, the isthmus, proximal grooves, and boxes. So, okay, so these are to enhance the durability, guys. Okay. Okay, coming to marginal integrity. So margins of restoration must be closely adapted to the finish line of the preparation. Okay, should be really close to the finish line. Okay. Uh, Configuration of the preparation finish line dictates the shape of restorative material in the margin of the restoration of, yeah. So basically, um, the marginal integrity comes from preparing the finish lines properly and restoring the tooth structure at the right place. Okay. Okay, so it would be well-defined margins, continuous margins, even and smooth margins located at appropriate level, guys. Okay. Follow contour of gingival margin, break contact with the adjacent tooth. Okay, so you have to follow all these factors first. Coming to the finish lines, guys. Okay. Okay, so finish line configurations are as follows. That is chamfer, heavy chamfer, shoulder, radial shoulder with bevel. Okay, and knife. So this was, sorry. Okay, so shoulder finish line is one which is recommended for all ceramic restorations only. Um, Resistance to occlusal forces and minimizing the stress that may lead to porcelain fractures. Adequate bulk of the material at the margin should be present. It requires much tool structure destruction. Okay, so this is a little bit wider and bigger. Okay, so 90-degree internal line concentrates stress coronally, and then there was, I guess, no fracture, right? Yeah. So coming to the modification of shoulder, so that is radial shouldered, rounded internal angles, shoulder with bevel. Adding a bevel to the shoulder creates acute edge of metal at the margin. Okay. So preservation of periodontium is also something which has to be taken care of, obviously. All right. So margins as smooth as possible, guys. Kept clean by the patient. So oral hygiene is maintained, duplicated by the impression. So um, any of the things which has to be taken care of before prosthodontic is perio, and the periodontium has to be taken care of. Okay, placed in enamel if possible, guys. Okay, and supragingival placement of margin lines wherever possible. Okay, so coming to the margin placements. So coming to the finish line, it should be placed in enamel wherever possible. Okay. Supragingival versus subgingival is always a debate, and usually wherever indicated, you give either one. Okay. Indication of subgingival margin. So here you see it. So that is caries to increase retention, aesthetics, and extension of previous restoration. All right. In cases of trauma. All right. So, guys, that was it for this lecture, and I will be continuing more of the tooth preparation in the part 2 of the lecture, which I'll be taking next week. So in any case, guys, thank you so much for patient listening, and you can find me for any questions or any doubts on level 20 polyclinic 3. Also refer to the standard textbooks, which I always tell you, Rosenstiel and Schillenberg, guys. Okay, thank you.